Hello, everyone. So, as a practicing radiologist myself, I wanted to put together some basic guideline information for those of you who may be interested in field of radiology, or for those of you who may not have much idea about what we do. So, about training, before I start talking too much about training, I should probably clarify that I'm talking specifically about diagnostic radiology. So there is a field called interventional radiology that utilizes real-time X-ray, but mainly focuses on the procedural part of this field. Now they used to do the same diagnostic radiology residency and just do a different procedural fellowship, interventional radiology fellowship for 1 to 2 years when I was a resident. But that has now changed, and now the interventional radiology has their own residency program. So what I'm talking about now does not apply to them. It applies specifically for diagnostic radiology. So for training to become a diagnostic radiologist, you would, after graduating from your college, you would do 4 years of medical school, and then you will join an intern year. That intern year, you have a few choices. You could do preliminary medicine internship, or you could do a preliminary surgical internship, or you can even do what they call transitional year. And during that year, you don't learn much, or if at all, in radiology in that 1 year. So you could choose whichever one that fits you the best. And then after that internship, you'll join a diagnostic radiology residency, and you'll learn, you'll spend 4 years learning kind of basics of all aspects of radiology during that 4 years. Now, when I was when I was in earlier years of my residency, it used to be that right after residency you could get a job and start practicing. The trend has now changed so that I would say more than 90% of graduates now do a fellowship after graduating from residency. Usually the fellowship is 1 to 2 years. The job market right now is so good for the applicants that the 2-year fellowship is now falling out of favor right now. So most people do 1 year fellowship. In terms of radiology fellowships, you have quite a few choices. You could do neuro fellowship, or you could do body fellowship. There's an MSK fellowship. There is also mammo fellowship. There's nuclear medicine fellowship, and there's also pediatric radiology fellowship. So there's a variety to choose from. So what do we do? The stereotype is true in that typically we do sit in a dark room with multiple monitors, and most of our work is around interpreting images, whether it be X-rays, ultrasounds, CTs, or MRs. While that is most of our work, depending on your work setting, most of us end up doing some simple procedures in a day. And when I say simple procedures, I mean like fluoroscopy procedures. So things like barium swallow exam or upper GI exams, or joint injections with contrast, or joint injections with steroids, or lumbar puncture, or even myelogram. So those type of very simple fluoro procedures. So what is our typical workday like? So I would say usually during weekdays, our work days are usually 8 to 5. And as we said, most of our day's work is just based on interpreting images. So for those of you who haven't seen a radiologist work before, imagining you're logging into your computer workstation, and once you log in, you'll see a list, almost like your email list. So it'll be a list of, patients who had their exams done. So in our list, you'll see patient's name, patient's exam date, and the type of exam. So like, was it a CT, or was it an MR? Was it an ultrasound? And what kind of body part was the image? So like CT of the head or CT of the spine. So you'll see a list of exams that are populated. Typically, other than like emergency exams, typically, radiologists would pick up the list and pick up cases based on whichever one got done the earliest. And so when you open up an exam, like opening up a file, then your monitors will populate with all the pictures or images that were taken for that exam. So as a radiologist, you will scroll through these images, and you also have a mic on one hand. So as you're looking at the images, you would kind of through the microphone dictate whatever you find is not normal on that exam. And once you're finished looking at all the exams, then you will kind of proofread your report. And then once you're happy with your report, you sign the report, and then you move on to the next case. And it's just repeating that those steps, just interpreting cases. Now, as we mentioned, during the day, you probably would have some procedures scheduled in between. So you would interpret a few cases. You'll be called to do a procedure, and after the procedure, you'll return into your workstation and you go back to interpreting images. In terms of interpreting images, they would try to tailor the work list so that you would be given greater proportion of the exams that you're subspecialized in. So let's say if you did a fellowship on MSK, then they would try to populate your work list with more like an MSK type exams. So you will continue to work like that till usually 5 p.m. And then once you're done with your work, you're free to go home. And our work is very much a shift, very much is a shift work. So that once you're done with your shift and you're done with your work, there's little to almost no pages after your shift is over. In terms of our calls are also shift based. Um, I would say our call shifts usually they don't usually give call shifts that are greater than 10 hours in length. So it's usually 8 to 10 hour shift. And it mainly revolves around interpreting images. So there's usually very little to no procedures expected during your calls. So talking about pros and cons of radiology, what do I think are some pros in our field? I think the biggest strength and what people, I guess, radiologists like the most currently is the fact that we can work remotely from home. Now, I would say after COVID, even finding a 100% remote job has not been difficult. So it's quite common now to see job postings that are 100% remote, working from home. Another good thing I think about our field is that our work is, like we said, is shift based. So I could easily, even on a work day, I could easily schedule for a dinner with my family or my friends at like 7 p.m. and know that I'll be able to make it fine because, after 5 p.m., I should not be getting pages or getting called to do more work. So in those regards, tailoring your work-life balance is quite possible in our field. Just to give you some example, I guess I'll share a little bit of my experience. So after graduating from fellowship, my first job was in a private practice where I was working, I would say 4 to 5 days a week. And I would say about 70 to 80% of that work, I had to commute to work. So only maybe 20-30% of that work, in a week, was remote at that time. And I would say the call shifts were that I would work one weekend every 5 to 6 weekends. And then in 1 year, I was given 8 weeks of vacation. Um, and I felt like between commuting to work, there was quite a bit of commute for me, I felt like, and between commuting to work and some personal life issues I was having at the time, I did feel pretty worn out and almost burnt out at that point already after 2, 3 years of being in a private practice. And so at that time, I went through a job switch to my current position. So my current position is 1 week on and 2 weeks off, meaning I work 7 days in a row and then I'm off for next 14 days, and I just repeat that throughout the year. And it is a 100% remote job, so I'm always working from home. Um, so after having been on current job, for 2, 3 years, I do feel quite rested now, and I feel like, feeling like burnt out. That has recovered quite a bit. So now I'm looking into maybe picking up some part-time shift during my 2 weeks off period. So just like this, there are many ways to kind of tailor your work-life balance in our field to fit what you think would work for you the best at the time. And another pros of my field, I think, is that there's very little what we call busy work compared to other fields. So, for instance, most other clinicians who see patients would have to, spend quite a bit of their time in a day to write out clinical notes for, medical records. In our field, there's very little of that going on. So most of our time is spent on actual clinical work, because our report that we dictate is basically our note. Um, and then I also feel like our salary is actually not bad either. So what are some cons in our field, I think? I think the biggest one obviously has to be that there is very little to no patient interaction. We all know that it is very rewarding to see a patient, treat the patient, and see them get better. But unfortunately, that's not the type of reward that we are often given. So I think, if your main goal in medical career was that factor, that rewarding factor that comes from actually seeing the patient, treating the patient, and seeing them get better, if that's what you absolutely cannot miss out on your career, then radiology may not be for you. Um, some other cons in our field, I think there is pretty heavy focus on productivity, like efficiency and speed in our field now. Now I know that it is true throughout the medical field these days that everyone is busy. There's a lot of work for everyone. But I think it's especially true in our field, um, in forms of like what they call work RVUs. So, for example, every exam that a patient gets done, like every imaging or scan, every imaging exam that a patient gets done, has a name and has some type of RVU. So, for example, an X-ray of a pelvis may be worth like 0.19 work RVU, whereas if you get a CT of the pelvis without contrast, it may be 1.1 W or work RVU. Now, depending on your job setting, they may require you a certain number of RVUs per day. So some job may say, okay, like on an 8 to 5 day, we expect you to be able to interpret so many exams so that you meet at least, let's say, 70 work RVUs in a day. So in this sense, there is pretty heavy focus on productivity nowadays in our field. Another con that I think that I personally notice is that I feel like comparing to other specialty physicians, I'm usually not as helpful to my family and friends. So when they come to me, asking personally, about some of the symptoms that they're having, I usually am not able to help them much unless they have gotten some type of imaging done elsewhere, or I may be able to help them. I think if the diagnosis is this or such, but again, I'm not a clinician, so I'm usually not well versed in what type of treatment are recommended for that type of diagnosis these days. So in that regard, I feel like I'm not as helpful to my family and friends. And another con is that, as we said, there's very little to no follow-up, meaning that, I may interpret an exam saying that I think the diagnosis on this patient is this or this. But, you know, since I'm not seeing the patient in clinic in the future, I will never know if if I was right or wrong, unless I personally follow up with that clinician and kind of see if I was right or wrong. So I think in our field, to improve one's skill, it takes more than just going through your job and just working your job. You will need to put some personal effort to get better. And then, so AI is such a huge topic nowadays, I think. And I think our field is very, um, very heavily impacted by AI, and I think there's a lot more to say about that. So I think I'm planning on um, dedicating a separate session or just for AI. But I do think ultimately um, it may come to a point where uh, maybe not in the future, not in the near future, but eventually, could physicians be replaced by AI? I think it is possible, but I can talk about that some more on another video. So who do I think would do well in our field? I would say those people that like doing puzzles or doing who like to problem solve. I think those would do well in our field. Also, it is sad that we miss out on patient interaction. But if you're the type of person that is okay with working alone quietly at home, with a cup of coffee and with some of your favorite music on the background, and if you're okay with that kind of work, I think you'll do okay in our field. Our salary varies quite a bit actually, depending on your job setting. So I will share some basic numbers to give you some real sense, and kind of based on my experience as well. Um, of all the radiologist jobs out there, I think the most common is going to be private practice, where you join a group. And that group of radiologists, they are not employees of the hospital, but they're a group on their own that contracts and does business with hospitals. Um, so usually the process is that you have to do usually 1 to 3 years of work with them as an employee, and then after that you get voted on and you become a partner. So during employee status, during that employee period, usually the starting salary is about $300,000. And then after you make partner, and in terms of making partner, I would say as long as you haven't done anything crazy and if you haven't made any huge mistakes, usually most groups would, you know, most voting process you will become a partner 90% of the 95% of the time. So the it's more formality, and so as long as you haven't upset anybody or made any huge mistakes, you will make a partner. But anyways, once you make a partner, then on top of your base salary you get a partner bonus, meaning that a group is a business entity. So after a year, if the business was well run and if you made profit, that profit is shared among all the partners equally. So for a pretty well run group, I would say once you make partner, your salary, with bonus and everything, would usually go over $500,000. I would say if the business is very well run, or if the group works their partners pretty hard, then I've seen people make between $600,000 to $700,000. And I've heard that if the group really works you like crazy, I've heard it's possible to make like 800 to $900,000 a year. I heard that's possible, but I do think that you're going to be expected to work very hard in that setting. Now, other than private practice setting, I think the other types of job settings are very much minorities. So one other type that you could look into is an academic setting where you're like an assistant professor, where you most of your work is still interpreting images, but you take on the role of teaching residents or medical students. Now, academic positions obviously they're not business. You are employees of the university or university hospitals, so your salary is not usually not based upon your productivity. Even though I know some academic positions do offer you a little bit of bonus based on your productivity, but it's not it's compared to the private practice setting partner bonus. The bonus in this academic setting is very little. So I would say all practical purposes, your salary is pretty much set, and that's usually $400,000 to $500,000 a year. Now, there is also a unique setting that's called independent contractor, where you're not really an employee of the hospital or a group, but you are a business entity on your own that contracts with the group or hospital, and you get paid based on your work. So these guys, the way in this setting you get usually paid is usually per day or per exams you read. So for example, if there's a local group that has gotten so much work this year that they need some help, you can become an independent contractor that does work for them. The way you will get paid is that when you sign your contract with them, you'll say, okay, I can work for you, so many days a month, and I can work 8 to 5 on those days. And they'll say, okay, for 8 to 5 day, we'll pay you between somewhere between usually $2,000 to $3,000 a day. Or there's also some settings where they pay you per exams you read. So meaning, so if I read for your group, one CT exam will, they will say one CT exam will pay you, $30 to $40 per one CT exam. And if you read for us MRI exams, we will pay you $40 to $50 per MRI exam. So they get paid per the work they do. Now these salaries that I just shared, they are for like what we would consider more normal setting, meaning these are not overnight shifts. They're just usual, weekday work. So our night shifts in radiology, they're quite busy because the ED stays busy overnight, and so there's still quite a few patients getting scanned overnight. So our night shifts are busy, so they usually get higher pay. Obviously, night shifts are not something that you can sustain, all year long with just like a few weeks of break. So the way night shifts are usually scheduled in our field is that you usually it's 1 week on and 2 weeks off. That's the most common night shift schedule that I've seen. So you would work, for example, 1 week of 10 p.m. through 6 a.m. shift. So whole week for 7 days you work that shift and you'll just kind of sleep in the morning or during the noon, during the early day, and then you come back to working the night shift. So after 7 days of working like that, you get 2 weeks off, and that kind of setting you will get paid about $500,000 to $600,000, even though you only work a third of the year, because it is overnight work. You get paid the premium price. So there are night shifts like that are scheduled in. So when you join a normal, if you're not interested in working the nights, even when you join the normal practices, you typically won't have to work overnight shifts because usually groups would hire people that work specifically nights like that. So the nights are usually covered. So when you join a practice, unless you really want to work the overnights for better pay, usually many groups don't require you to take overnight call shift. So when we say call shifts, that's usually weekend calls where you're working the daytime but just on the weekends. But if you're interested in making a lot of money, then yes, night shifts would be the premium pay. Briefly about upcoming topics that I'm considering, I do want to talk a little bit about AI and radiology because I do think that radiology is it's going to be heavily influenced by AI. And I think, especially if you're a student at this point, and if you're wondering if you should go into radiology, I think it's worthwhile thinking about this topic, and especially the topic of are physicians going to be replaced by AI, and what do people think? It's going to be very personal opinion, but I'm happy to share my 2 cents on it on a separate video. And depending on the radiology specific topic interest, I would be happy to share my experience as a radiologist about different job settings that I've experienced, like academic practice versus private practice versus independent contractor work. And that is all I've prepared for today, and thank you for your time.